10, still here, that's all me. Black love 2D. Damn.
Hello, everyone. Welcome in. I'm going to give everyone just a few minutes to get settled, and then we'll get started with our presentation today. While we are here, I think we can ask folks to let us know. We can see your name, although if you haven't put your name in your Crowdcast user account, please do, or let us know your name. So we want to know your name, your pronouns if you want us to know your pronouns, where you're joining from, and why you're interested in this topic. We hope you're interested in this topic because it is a plenary. It's available to everyone, and we think there might be some new information in it. So let us know. And I'll get us started verbally by telling you my name. I'm Rula Abisamra. My pronouns are she or they. You can use both. I will facilitate today's session, but introduce our speakers separately. And I'm joining from Atlanta, Georgia. I'm interested in this topic because it's been 15 years since I personally provided, abortion care in a clinic for the first time. And a lot has changed since then. And I used to think I knew everything about it. But things have changed. And it's been a long time since I provided care in a hotline as a practical support organization staff. And so it's time to learn what's actually happening in 2022, especially since the abortion ban has gone into place. So we're going to learn a little bit about what was it actually like, or what is abortion actually like overall in the United States, recognizing that practice does differ among countries and among states. Then we're going to learn what did the law do here in Georgia over the past many years. And then we'll learn, since the overturn of Roe, how have things changed right now. So I realized I'm not sharing my screen, but I'm going to. And we'll have a bit of an abridged session. So instead of waiting till the end for Q&A, if you have questions for our speakers, please use the Ask a Question button down by the chat, and we will lift up those questions to our presenters as we go. All right, here we go. All right. Abortion 101, Georgia 2022 edition. Please welcome Naomi Desta Bell from the Feminist Women's Health Center, Ukwuoma Ukairo from Access Reproductive Care Southeast, and Agbo Ikor from SPARK Reproductive Justice NOW. In the interest of time, I am not going to read their full bios, but I will share again our program link with the speaker bios so you can really get to know their backgrounds. And I will let each of them explain what it is that they do in their positions at these organizations as they go. So here's what y'all are doing. Tell us who you are and where you're joining from and why you hopefully are interested in this topic. All right. Without further delay, we're going to pass it over to Naomi Desta Bell of the Feminist Women's Health Center. She is the community outreach and education manager there. And Naomi, what's an abortion?
Hey, Rula. Thank you so much for having me here today. So first and foremost, whenever I speak about what an abortion is, I think it's really important to ground in sharing that abortion is a very common and safe medical procedure. It's a very common method to end a pregnancy. And there are two broad types of abortions. Historically, we've heard the term surgical, which is something that we're moving away from. We don't want folks to be confused and thinking that this is something that is surgical. And then there is medication abortion. There are a lot of false myths from folks who don't believe that people should have the option to choose an abortion. At our clinic at the Feminist Center, we really think it's important to reiterate for folks that although every medical procedure does involve a level of risk, the truth is that complications are very rare with an abortion. An abortion is also safe in the long term. An uncomplicated abortion will not affect someone's ability to have children in the future, and it's also not linked to any future health issues.
And I believe I was supposed to come in with a slide, which I don't have, but some information about safety data on abortion. What I can tell you is that the risk of major complication from abortion, which is defined as deaths, hemorrhage, needing to go to the hospital and be like checked into the hospital, those three, as well as infection. Those are what we call major complications, and all of those, the rate of them happening are less than 1 in 100,000. Usually it's just enough to know that it's very safe, less than 1 in 100,000. In fact, when you look at the number of first trimester abortion procedures that have happened, it's closer to 1 in 1 million. And 1 in 100,000 is less than what, the complications from taking Tylenol or penicillin, but those are safe too. Those are good for us, and so is abortion. I will let us go forward now.
Abortion is healthcare. This is an important point that I think is really vital to make. A lot of the times when we hear conversation around abortion, there is a lot of stigmatization and there's a lot of polarization. But when we center abortion around healthcare, it grounds us in the remembrance and the understanding that it's vital, that it's important, that it's necessary, and that it's safe for us. And also that all kinds of folks get abortions. Our clinic has been serving folks in the South for over 40 years. That means folks outside of Atlanta where we're based. These are folks who come from a broad range of socioeconomic levels, different religious backgrounds, different ethnicities, different ages. We see mothers, we see folks who are partnered, folks who are not partnered. We see folks who are students, we see folks who work on the ground. We see everyday people across the board come in to access this important care, just like anyone else would go for any other healthcare service. Next slide, please. If someone opts for a procedural abortion, the process that they would go through upon entering our clinic begins with the administration of local anesthesia. This is done to numb the cervix area or for more overall sedation. The procedure begins with a very gentle opening or dilating of the uterus or cervix. Afterwards, the provider would insert a small tube connected to an aspirator, a medical instrument that creates a gentle suction. This is used to remove the contents of the uterus. Sometimes this process is completed using medical instruments to make sure all pregnancy tissue are removed from the uterus. A medication abortion, commonly known as abortion by pill, involves taking a combination of pills called Miffy or misoprostol. In the US, this option is available to folks who are still in their first trimester of pregnancy. The first pill, called Miffy, is taken at home. Now, in 2022, we have an update that the FDA allows this to be done at home without a doctor's supervision, although some clinics do still have the option for folks to come in to have the first pill taken under the doctor's supervision. Sometimes folks have a few more questions and they want to have that one-on-one communication and care with their provider. Miffy works by blocking the hormone progesterone. This hormone is naturally occurring and it's necessary for a pregnancy to continue. After this first pill is taken, 6 to 48 hours later at home, the second medication is taken, misoprostol. That causes the uterine contractions and the pregnancy itself to be expelled. It is this time period in which folks will experience cramping and bleeding, and this can last for a short number of time to a couple of hours, depending on each person. Who provides care at a clinic? We've been speaking a little bit about providers and physicians and what they do. Under Georgia law, only physicians may provide the abortion procedure or the abortion medication, but nurses, techs, medical assistants, health workers support patients in a range of clinical ways, from pre-procedure checkups to assistance in the op room to post-abortion and check-ins. So when folks come to our clinic, they are first greeted by one of our wonderful clinic escorts. Clinic escorts support patients as they enter the building, and they often serve as a buffer between protesters, quite physically providing a form of protection. Other times, say someone is coming in for the pill, and they don't need to have a driver with them. A clinical escort is there as a support system, oftentimes serving as a friend. Health educators prepare patients for their abortion. They provide a safe space to talk before the abortion and share instructions for what to expect. This goes beyond just reviewing folks' health history and answering medical questions. It's also a check-in for where folks are emotionally, how they're feeling that day, who's with them, who's not with them, what's going on in their lives, and any other feelings that might be coming up around their abortion. Health educators also provide referrals. They provide resources for practical care, for practical support, and for mutual aid, other practical needs that folks might have, because we understand from a reproductive justice framework that oftentimes when people come into our clinic, they're not just coming in for an abortion. There are a myriad of needs that people have, and we want to make sure that we're able to point people back when they leave our clinic to follow up on other care that they or their family members or their children might need. Afterwards, patients are supported by patient advocates who provide emotional support during the abortion procedure or medication administration. These folks make sure that when someone's in the clinic, through the different stages of passing through lab, through health education, that they have gathered all the correct information that they need and that they're clear on the next steps going forward, whether that means going to meet with their provider for the procedure or taking pills to take home. They make sure that they have the right resources, and they're the final step before a person leaves our clinic and that last point of contact.
Okay. Naomi is, oh, sorry. Yes, I'm on not muted this time. Naomi, is there anything else you wanted us to know about abortion at the clinic and abortion care before we move forward to talking about what does it really take to get an abortion in Georgia?
Nothing else other than wanting folks to know that abortion is still legal in Georgia up until 6 weeks in this time, and that we're providing care as best as we can to folks in our community, and to encourage folks to get the care that they need.
Okay, thank you very much. I'm sorry we did not have a slide showing, Feminist Women's Health Center yourselves, the clinic, the community organization. I hope we can have a little bit of time to hear about your work, letting community know that you all exist and are there for them. Okay, we are going to transition next to our next speaker. Remember, if you have questions for any of the speakers or about this topic generally, put them in the Q&A box. Next, I'm going to bring up Ukwuoma Ukairo. And the reason I think it's really important that we always bring in the realities of practical support organizations' work and the realities of funding for abortion is that that's the reality of what really getting an abortion is wherever we are. It's extremely place-based. And I know that when I went from working in a clinic to working in a funding hotline, my whole view of who needs abortions and what they go through really doubled and tripled. Suddenly I went from, I'm answering phones at the clinic. People ask me, when can I come in, or how much does it cost, or what do I have to do? And then sometimes, they're calling to ask about prices because it's expensive. So they call and they say, okay, thanks, bye. And I answered so many calls a day, made many appointments in a day. And then maybe half of those people would show up for their appointments, most of the time, not because they decided they didn't want an abortion, but because other things were going on that meant they needed to reschedule or that they were not able to come in. And so that was not part of my awareness until working in a place that was about abortion access. So I'll turn it over to Ukwuoma, and having a bit of trouble getting the slide running, but it's going to happen. Please bear with me.
I actually don't have a slide, Rula, so
okay.
I'm not sure what you're pulling up, but I'll read that if you'd like.
It's really just a title slide, so maybe that's fine.
Or yeah, feel free to. You're more than welcome to.
Okay, well, I'm going to let you take it over. What does it take to get an abortion in Georgia? If you could start with explaining, what's the health line at ARC Southeast and what someone is going through when they call.
For sure. I'm going to start with introducing myself.
Yes.
And then I will nosedive right into that. So my name is Ukwuoma Ukairo. I use she, her, or they, them pronouns, and I'm the caller engagement coordinator here at Access Reproductive Care Southeast, or colloquially speaking, you'll hear ARC Southeast, ARC, the hot girls, whatever you want to say. That is our lovely website. And to answer Rula's question, so ARC is kind of like externally two 2 buckets of work, and then internally 3. So externally, we have like the programs, organizing, and outreach, which is the work that I do. And then we have the health line, which is you call that number 855-227-2475. You let them know when your appointment is. They say how much they can assist you with. They send the money to the clinic. Bada bing, bada boom. The community organizing and outreach is the spreading awareness, programs, and care for folks after their procedures. So one of the many things that we do is lead a support group called So Now What? And it's a monthly peer-to-peer support group for folks that have had abortions, just to like come talk, see how they're doing. And Georgiana, I see your question. Just give me 2 seconds and I'm going to get to it because that's honestly a really good one. Yeah, it is incredible work for someone to get to call an organization and literally just get the care they need. I think a lot of times, like, we repackage policing by like forcing folks to like present their poverty and present like some of the most like traumatic parts of their experience in order to receive care from us. Like, how do they convince us that they are worthy of help other than just saying I need help? And so I think it's really important that someone can just call the health line, express a need, and have that need met. And where we like take like the outward facing part of that is like the community organizing, making sure that people know that we exist. Cool, thank you, Rula. Making sure that people know that we exist, making sure that people know that they can call the health line, that there's no stigma, that it's completely private. And so things have changed rapidly outside of like Roe falling, and then more specifically in Georgia, the 6-week ban going into place. And so I'm based in Atlanta, Georgia. And I don't know if I said this, but I'm the caller engagement coordinator at ARC. So what that means is that I connect with our callers after their abortions, and like see if they want to come to support groups, see if they have any needs that are not being met, connect them with like anyone who might like be able to support them community-wise, let them know about mutual aid going on, let them know about like opportunities for abortion storytelling, which is a really cool way for folks that have had abortions to be able to like move through that experience and share that with other people and destigmatize abortions. Because as Naomi so like articulately put, abortion is just healthcare. It's literally just going to a practitioner, getting a healthcare procedure, and going the hell home. Like it's not like this like deep dark thing. It has been politicized and weaponized as a tool of white supremacy, but it is not indicative of the procedure itself. And so ARC is really, really big on like taking that stigma away, putting the power back in the folks that like had like the courage and the bravery to take control of their own bodies and their own healthcare, and like supporting them how we can to get them to the care they need. And so one of the questions that was asked, and please feel free to keep asking questions. Let's see. Okay. So I'm going to let Naomi answer a question for Feminists, but we are going to discuss abortions past the 6-week ban, and can ARC help with money for a mail order abortion? Great question. So first and foremost, thank you, Lisi. Absolutely. First and foremost, most people do not know they're pregnant at 6 weeks. And the ban is intentional in that way. And I don't want y'all to think, oh, they just thought of a number. Like, no, they intentionally did it so that like most people would not be able to get abortions. And so what we are having to do now more, because we serve 6 states. We are headquartered in Atlanta, and a lot of our staff is in Atlanta and the greater Atlanta area, but we serve 6 states. So Florida, South Carolina, Mississippi, Tennessee, Alabama, and Georgia. Did I repeat any of those? No, okay, I didn't. And so in Alabama and Mississippi, there's total bans. And so we know that callers from those states are going to have to come to somewhere like Georgia to access care, period. Now in Georgia, there's the 6-week ban. And so we were sending folks a lot of times to North Carolina so that people weren't like too far from where they live. Now, North Carolina has put in a 20-week ban, which of course gives us a lot more time. But even so, there are like abortions that take place after that time period as well. So the barometer, like the parameters put in place are not indicative of healthcare, but indicative of the state trying to control pregnant folks' bodies. Also, the part of the North Carolina 20-week ban that I think is important to note is there was a lot of verbiage around like fetal anomalies, a lot of which cannot even be like diagnosed or seen until 20 to 23 weeks. And so it's not backed by science. It's truly just backed by like politicking. And so what we do, another part of the health line is, say you were to call and you're like, oh, I have an appointment at APWHC Charlotte, which is an abortion clinic in Charlotte, North Carolina. And you have secured the funds, like we have sent funds, you've gotten funds from maybe the Carolina Abortion Fund, the National Abortion Federation. The money is there for the procedure, but you don't have the support to get there. We would do one of two things. Either we would get you like a flight to Charlotte and get you a hotel while you're there, or we would reach out to one of our incredible volunteers and they would drive you from blah, 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 Georgia to Charlotte, North Carolina. And so we work in tandem. The programs team works in tandem with the health line to onboard volunteers. I heard that South Carolina block their banning cares. Yes, also South Carolina. Thank you. Thank you, Zoe. We work in tandem with the health line to onboard and prepare volunteers to get people to the care that they need. And so we have a lot of volunteers in Georgia. We are trying to expand to the other 5 states that we serve so that we are able to get people from wherever they are within our region to wherever care is available. But practical support and coordination, as I'm sure you can imagine, like if I was pregnant and I needed an abortion, me going up to Feminist is a relatively inexpensive thing if the procedure's been paid for. Like I just need someone to take me there, get the procedure and come home. But me having to travel to Charlotte, North Carolina, if I have a job that doesn't give me PTO, if I have children and I have to secure childcare, if I don't know anyone in Charlotte, so I have to figure out where I'm staying, that's a much more expensive thing. And we go from like hundreds of dollars to thousands very quickly. And so the money that we are spending from the health line and just from like the practical support part of things has exponentially increased with abortion bans becoming more widespread. So to like bring it all full circle, what it takes to get an abortion is honestly a glass of wine and a magnifying glass. Like it is a very difficult thing because of these bans. And organizations like us, like Feminists, like all the people that we work in tandem with and the other abortion funds are really trying hard to create practical support networks so that like if people need to access care, like say you needed a late stage 3rd trimester abortion. I could not get those words out of my mouth. And you need to get to DC, making sure that we have like good relationships with the DC Abortion Fund and like the clinic at DuPont, and making sure that like we know who to contact and we have like connections to like their volunteers on the ground. And a lot of that really is community organizing. Like as much as I am a staff person at ARC Southeast, we work within a coalition to make sure that we are always in the know of each other. And then I'm a board member at the Baltimore Abortion Fund to like keep like an idea of what's going on there. I'm a Maryland native. And so because abortion access looks very different there, and we know that we are inevitably going to have to utilize like their clinics, it is important for us to have those relationships. So what have we learned from Healthline Callers' experience? We have learned that stigmatizing abortion is it's just killer, y'all. It really is. And it is killing and really hurting our people. And hearing how many times people said, one, like they literally would not have been able to have this procedure if it wasn't for us is really hard. And two, excuse me, y'all, how many people in their life, okay, Sharon, yes, I'm from Columbia. How many people in their life like who also had abortions made them feel shitty for like accessing healthcare and doing what was best for them. And we've also learned that Healthline callers are like not really that involved in movement. And I think like it is like my work and also like part of our community work to like kind of like degrade some of the barriers for them. Like sometimes the rhetoric that we use that we think is so widespread is a really big barrier for our Healthline callers, and making sure that they feel really welcome in spaces like this organizing summit and some of the other programming that we do across the coalition, across the Amplify coalition. So yeah, I would say mainly just like destigmatizing a lot of aspects of their experience, both pre, during, and post-abortion.
Thank you. And I think one other thing I have learned from data that was recently published in a healthcare journal about just looking at callers' background was that everything that we know statistically about abortion patients overall and in the whole country, like that a majority of them already are parents, a majority are lower income and trying to make ends meet, and that people of color are more directly impacted by barriers. That's like doubly true in Georgia and on the Healthline, based on, folks who are calling for assistance, right? That 60% of folks having abortions nationally are parents already. In Georgia, on the Healthline, it's 70%. The percentage of people who are calling the Healthline who are Black, Indigenous, and people of color is very high. It's 80%, which I think represents how many barriers BIPOC folks face. And what I learned that has always struck me is that 90% have Medicaid or are uninsured. And in Georgia, Medicaid currently doesn't provide coverage for abortion care. So you may as well not have insurance on that end.
And I think it's important to like break down part of what Rula just said. That's 70% are, 80% are BIPOC folks who are calling the Healthline. That is not 80% of folks who are having abortions. That just means that, like,
that's right,
persons who are not of color have the resources they need to just go to the clinic and pay the money. And I really want to like kind of like add some numbers to your heads, because I did not realize before I worked at ARC how expensive this shit is, like for real. Like we were funding a 27-week procedure. I want to say either 27 or right about 28. And it was over $25,000. Like it was a very expensive thing.
Mm-hmm.
And the idea that like someone just has that money to spend is inconceivable with like all the other things we know about socioeconomic status. There was something else I was just about to say. I would be remiss if I did not also amplify the power of community organizing. We live in Atlanta, or I live in Atlanta, Georgia, which is like very cool. And I think it's important for us to, I will answer this volunteer question in just a moment. One thing about me, y'all, I have ADHD. So like one thing pops up and my brain is like, oh, let's go play with that. So apologies if I'm all over the place. But one thing I really want to amplify, we are in Georgia, a state that has a 6-week ban. And because of community organizing, because of the powerful leadership across the Amplify Coalition and at Amplify Georgia as an organization, we were able to get the Atlanta City Council to redistribute $300,000 to ARC Southeast. I know that doesn't sound like a big deal, but it's a big fucking deal for like that money, like in a state that has a 6-week ban, to like for the city of Atlanta to redistribute funds to fund abortions. Like it is like antithetical to the legislature and like just incredible. So definitely powerful community organizing. I feel really honored to be like in community with y'all. It was very big pimping, and I'm still floored when I think about it. Like incredible. And so shout out to the amazing folks at Amplify. Like I love y'all and like feel truly honored to do this work alongside y'all. And
Thank you so
absolutely.
much. No, you want to close out before we go to
answer
Agbo?
these questions super quick and then I'll get on my way. How can you post how to access the support group? Great question. And then I know someone asked a question of Feminist, and I'll let Naomi take that one. So the support group is actually, you can reach out to me directly. Because of like security reasons, like I'm sure it's not news to y'all that a lot of people do not believe in accessing abortion. And I facilitate our support group and I am the point person for it. So if you know anyone who wants to join it, they would have to email me directly, because if they don't have the link and I don't know their first and last name, they will remain in the waiting room just for security purposes. I just have to be very protective over our callers. But they are more than welcome to join us. I would just need to like know that they are joining us. And I'll put my, Rula did. Oh, thanks, Rula.
I'm sorry. Is that all right?
I was about to type.
Great.
Can ARC help with money for a mail order, a mail order self-managed abortion? So pretty much like the medication abortion that Naomi was talking about. Right now, no. But that is heavy on the right now. There's a lot of reasons, and I'm going to let Agbo speak to that a little bit. But there's a lot of legislature around mail order abortion and like the abortion pill and telemedicine. And so while we are navigating what that looks like in not only Georgia, but the other 5 states that we serve, we have to really make sure that we have, is it okay to share about the support group with clients that have had abortions? Talk to me offline about that. It's really important that we are strategic in the way that we use funds, because we would never want like the police or whomever to be able to criminalize a caller. And I just want to give an example. There was Lizelle Herrera, who was in the Rio Grande Valley in Texas, I believe, and did a self-managed abortion at her home. There was like some complications, like very mild ones, but some complications. Allegedly, child, because you know these folks be lying. Glad you said that, Rula. And she was literally charged with murder and in jail. And so we are really serious about like not involving the police, period. And not criminalizing our callers or subjecting them to criminalization in any way. And so while we are navigating that, once we figure out what that can look like, then we'll probably look into being able to support people in that way. So great question. And I'm going to put my email in the chat if you have any questions for me personally. Oh, volunteering. Glad y'all asked. When Roe fell, we got over 500 volunteer applications. So we are not taking any more until early fall. If you want to email me specifically and be like, I'm interested in being a volunteer, I can kind of walk you through what that looks like. But right now, because of like a lot of staffing stuff, the programs team is only myself. And so I just don't have the capacity right now to take on interviewing volunteers and onboarding them. But volunteering will come back soon. I'm going to put my email in the chat. Thank you for asking. But yeah, that's all the tea I have.
Ukwuoma, thank you so much for that. I really appreciate all that you have shared, what you all do for callers on the Healthline, and how you are contributing in your daily work to building power by making sure that the people most impacted by barriers and who have accessed support on this one-time basis are realizing that the movement is theirs, and that we can't actually do this in a way that makes change for people who need it most and ourselves if we're not led by those who have accessed those barriers, experienced those barriers and seen all that it takes to go through that. I am going to pause, look at the questions and see where we are on them. And then we will move to hearing from Agbo about one of the completely unnecessary barriers that is not a law, but that the state is supporting to put in people's way.
I'm so sorry to interrupt you. Can I say one quick thing?
Mm-hmm.
Nanny, thank you for uplifting this. One other thing that is like definitely something that blew up and it's something we're really proud about. And I'm so glad that like Nandi like uplifted that. We distribute free emergency contraception, and we could go into depth about what emergency contraception looks like and how preventative it is for a pregnancy. But yeah, so if y'all ever need Plan B, just reach out to me directly and I can get it to you. We have so much. Okay, now I'm done.
All right, thank you so much. So let's see. Questions we have answered. Are we going to discuss accessing abortions past 6 weeks? Yes. We can't go into every scenario, but my suggestion, which I've put in the chat, is that providers and people helping patients or people who are pregnant should reach out to ARC Southeast or look up their nearest practical support organization or abortion fund. Because why am I saying like I can't tell you a list of providers? Because it's highly dependent on circumstances, on whether the provider is available, is comfortable with the risk involved potentially, if they are getting swamped already. And so that information can change and it's not always public. I would highly suggest being in touch with your local practical support organization, and that is whether you're a person who's pregnant or a person who's helping them. In addition, especially for folks who are not in Georgia, but also to help relieve some of the burden on ARC being the source of information, everybody should know this link that I'm about to put in the chat. ineedana.com or ineedanabortion.com. If you go there, I won't take you through it, but please feel free to explore. Two things I really, really appreciate about this site. The first one is that it does not track or save your information. The second one is that it allows you to put in just a few salient pieces of information, nothing personal, but it also doesn't, well, of course, pregnancy is personal, but it does not track any of your information. It certainly doesn't get your identity, but it also doesn't store these pieces of information. How old you are, the number of weeks pregnant you think you are, and where you are located. It uses that information to basically sort its directory of clinics and practical support organizations, like the work that ARC does to help with rides and lodging and funding. And then it tells you, the nearest clinic to you is this many miles away. Here's a list of other ones. It can also say, these are the laws in your state. In your state, a person under 18 needs to go through these additional steps to be able to have an abortion. Or there's an abortion ban in your state that will not allow you to have a procedure at this many weeks, but here is the next nearest state that does. And here are options for self-managed abortion that is safe and reliable and effective. Self-managed abortion is something that we will talk about in the session on protecting ourselves and others from criminalization this afternoon. It is not a full webinar on self-managed abortion, but we will give you information on where to find that. And that's why I really appreciate ineedana.com, because they provide all of those options in one place for you to find. And finally, it's updated week by week, day by day by real people who are trusted partners in the movement and are really diligently keeping track of all of the updates. So moving on, we have shared how to access the support group. It would be best to contact Ukwuoma at the address that she shared in the chat, or that I shared for them in the question and answer box. Can ARC help with money for mail order self-managed abortion? I did not find out if you answered that. Did I miss it? Okay, we'll circle back. Okay, thank you. And how can folks tap in? We've answered that. Great. And so remaining questions. Naomi has answered the question about tracking how many people have to be turned away in the question and answer box. Please check that out. Talking about how to help people with home menstrual extractions and safety aspects of that. Both menstrual extractions and self-managed abortion will be a content for another session, but stay tuned with us. I personally believe self-managed home menstrual extraction is another level of difficulty, and it's pretty involved, although it's simple and safe. So I don't think we'll have time to talk about that, but we will keep the conversation going. And the process for providing lodging to someone seeking an abortion, Catherine, involves, if the person is going to share their own home, that involves a lot of vetting. usually through a volunteer program with an organization like ARC Southeast. So you would apply as a volunteer to offer that. And yes, donations for hotel lodging is absolutely a common way that we would be able to, that ARC is able to, and other practical support organizations also provide lodging in a city that we may not have contacts that are part of the volunteer network. Okay, let us move forward. Agbo, I'm going to, great, I see you. If you can come on camera, then we will be able to see you as well. And I just have a placeholder slide. This is Agbo Ikor. I will let her introduce herself and the work that SPARK does overall. And then please, Agbo, tell us, what is it that makes anti-abortion centers or crisis pregnancy centers such a problem? And where are they? And how many of them are there?
Absolutely. And maybe a little bit into my piece, I may go off camera for bandwidth issues, so folks can continue to hear me. But yeah, first I will start off by just introducing myself and SPARK. So my name is Agbo. My pronouns are she, her, hers. I'm the Policy and Advocacy Director with SPARK Reproductive Justice NOW. We are a grassroots Atlanta-based reproductive justice organization that operates on the intersections of reproductive justice and trans liberation. So just to give like a brief rundown of like who SPARK is, what we do, we work to build and strengthen the power of our communities and a reproductive justice movement that centers Black women, women of color, and queer and trans young people of color in Georgia and the Southeast. We fostered a dynamic collaborative model of advocacy, leadership development, collective action, and discourse that creates power for Black women and queer individuals' struggles for reproductive justice. So we were created actually for the purpose of building and strengthening the power of our communities and generating an RJ movement that centers Black women and queer and trans folks of color in Georgia and the South. So we did this by incubating and conceptualizing this radical queer analysis of RJ. It was founded by two young queer women of color in 2007. So we're celebrating our 15-year anniversary this year. It was birthed out of just like this knowledge and this belief that we need to center queer and trans and gender expansive folks in organizing and advocacy when we talk about reproductive justice. So this is going to turn off my camera and actually share my screen so I can actually get this to work. So 1 sec. Okay. And all right, so I did want to take some time to talk about anti-abortion centers. So we've heard from two amazing individuals from Feminist Women's Health Center and then from ARC Southeast. These are the folks you want to connect with if you want to actually receive healthcare. If you want to receive abortion care or just, reproductive health care, you go to Feminist. If you want to receive support to access that care, you go to ARC Southeast. I'm going to talk about the complete opposite of those wonderful organizations and talk about anti-abortion centers, also known as crisis pregnancy centers, pregnancy resource centers, coercive pregnancy centers, fake clinics. These are, as I've said in various names, these are places that essentially convince folks not to get an abortion when you go to access their services. So what are anti-abortion centers? Like I said, also known as pregnancy resource /care/support centers, crisis pregnancy centers, fake clinics. They're nonprofit organizations commonly ran by pro-life Christian groups that counsel pregnant folks against having an abortion. So I believe Rula stated earlier, you may have seen these billboards that say pregnant, scared. If you've seen those are typically linked to crisis pregnancy centers or anti-abortion centers. Basically, if you are in a situation where you are pregnant, you don't know what to do. You may not have the resources to support a pregnancy right now, or you're really just looking for like what your options are. They're really trying to target you so you can go and use their services for the express purpose of convincing you not to have an abortion. Like whatever you do, don't have an abortion. And just how they're harmful. They often promote themselves as medical clinics that offer unbiased information and support. That is false. Their information is very much biased. They definitely have an agenda with the information they do provide. Most of them are not licensed and they do not have a medically trained staff. So that is really, really important because they purport to offer medical services, particularly for pregnant folks, when they don't have medically trained folks on staff. In addition to that, because they don't have any like licensed medical providers, they aren't, they're not required to keep your information private. They do not have to align with any HIPAA standards or anything like that. So if you are pregnant, maybe you are considering an abortion and you go to use these facilities and you're like, yeah, maybe I want an abortion. That is not something that they have to keep private, right? And of course, with all of the climate today, with abortion services being criminalized or folks, wanting to access abortion being criminalized, that is actually very, very scary that these entities can just share that information however they want. They refuse to provide referrals to abortion clinics or actual health care. They're often located close to abortion clinics and have names similar to abortion clinics. So that's particularly like just egregious, petty, whatever you want to call it, and that they are so focused on misleading folks to use their services. They will place themselves close, like literally next door to actual clinics, and like have their names resemble actual clinics. I think there was a case, I want to say like in Massachusetts or something like that, when, for example, there was an actual clinic that was like, I'm really just like making it up, but like Women's Resource Center or something like that. And that was like the abortion clinic's name. And then like the Crisis Pregnancy Center was like Resource Center for Women, something like that. And they are right next to each other, basically trying to convince folks or confuse folks enough so that they are going to a crisis pregnancy center instead of actual healthcare. They often shame those who are seeking an abortion, and those practices have actually ramped up since the overturning of Roe, in that they feel a bit more empowered to lie to folks, to shame folks for wanting to get an abortion, to lie to folks about like how far along they are in their pregnancy. As you know, Georgia currently has a 6-week ban in place. So it's very, very important that folks know like how far along they are in their pregnancy. But crisis pregnancy centers, they are more liable to lie to folks about that. So they feel like they can't have an abortion at a particular point. They engage in false or misleading counseling and provide false information. And I've talked a little bit about this, but here's just like some other like lies they tell folks. So to discourage pregnant folks from getting abortions, staff members of anti-abortion centers will give false medical information to their patients. It usually includes assertions of a link between abortion and breast cancer. False. Post-abortion syndrome, assertions of a link between abortion and mental health issues like depression. Also false. Assertions of a link between abortion and substance abuse. Also false. So, basically implying or outright stating that if you get an abortion, you will have all of like these negative health outcomes, physical health, mental health outcomes. As I stated before, it's also common for these centers to give pregnant folks false information about how far along they are to decrease the window of time a person has available to access actual abortion services. So like I said, Georgia has a 6-week ban. So it's very, very important that folks know as soon as possible whether they're pregnant or not. If you go into a crisis pregnancy center looking just like for a free pregnancy test or a free ultrasound, they are liable to lie about how far along you are so that you feel like you cannot get an abortion, so that you cannot make the most informed choice about your reproductive health. So how do you recognize AACs? As I mentioned before, maybe you saw these billboards called Pregnant, Scared, Pregnant and Alone, Know Your Options. Those are typically linked to crisis pregnancy centers. We also have this lovely website, www.crisispregnancycentermap.com. If you go there, you'll be able to see where crisis pregnancy centers are located around you, so you may avoid them. If you go to a crisis pregnancy center website, so in some places, maybe you Google abortion, it's likely that one of those top results will be a crisis pregnancy center. So if you find yourself on one of these websites, here are just like a tip to notice whether it's an actual clinic or a fake clinic. If the website does not explicitly state whether it provides abortion or not, it's probably an anti-abortion center. They're very cagey about whether they'll state that they provide an abortion, because again, the point is to get you through the door so that they can essentially preach to you, prevent you from getting an abortion and convince you not to get an abortion. You want to always ask whether they have a licensed medical provider on staff. And I would say this just in general with any clinic you want to go to, just double check to make sure that they do have licensed medical provider, whether it is a licensed registered nurse, a doctor, an OB, someone who is liable to protect your information from being shared out, who actually has to abide by HIPAA. Look for words like pregnancy options, pregnancy resource center, or pregnancy care center. Those are just some buzzwords that come up when talking about when crisis pregnancy centers are kind of advertising themselves. And if/are there questions in the chat, I will get to them when I'm able to go back to the page. Right now, I just can't see your questions, but I'm happy to answer them as they come up. So some states actually allot federal TANF funds to anti-abortion centers. For example, in Georgia, though we don't allot TANF funds, in 2006, Georgia passed a bill that created the, quote, Choose Life license plates. You may have seen them around on just different cars. I know I shudder every time I see them. But revenue from those plates go to Choose Life Georgia, which is an anti-abortion organization that reallocates those funds to anti-abortion centers. And then in 2016, and this was actually my first kind of foray into repro rights, repro justice works, doing work against this particular bill. In 2016, Georgia passed the Positive Alternatives for Pregnancy and Parenting Grant Program, which allotted state funds to anti-abortion centers. So taxpayer funds going to fund these entities that essentially lie to folks. So how do we fight against anti-abortion centers? And just providing some examples of what other states have done. Organizers in Connecticut successfully passed a law that would ban deceptive advertising practices from anti-abortion centers. And that's something we hope to repeat in Georgia, and I'll talk a little bit about that a little later. The New York City rule, Pregnancy Services Centers Disclosures, requires all clinics to disclose if it does or does not have a licensed medical provider on staff who provides or directly supervises the provision of all of the services at such pregnancy service centers. So making it clear that whether they do have licensed medical providers, and that was a rule that was passed in New York. King County and Washington State implemented a similar law as well. And then many states and municipalities have passed or attempted to pass ordinances that require anti-abortion centers to disclose that they're not healthcare providers. Caveat, as these regulations, laws have passed, of course, anti-abortion centers have, sued so that they do not have to abide by these for various reasons, and various just legal explanations as to why they feel that these laws are unconstitutional or just unfair. So this is what it looks like in Georgia. The state of Georgia has 26 facilities in the entire state that provide abortion, while we have 90 anti-abortion centers. And then Metro Atlanta alone has 9 facilities that provide abortion. but 19 that are actually anti-abortion centers. Georgia has allotted over $10 million to anti-abortion centers since 2016, since that bill passed. That number, since this slide was created, I'm sure that number has increased, but it's kind of hard to track how much money has been going to anti-abortion centers, just on like, the note that they do operate successfully by secrecy. It's very hard to see, okay, so once these funds are allocated to the Department of Public Health, how does the Department of Public Health allocate those funds to anti-abortion centers? It's very, very hard to like follow the money there, and we're hoping to make that a bit easier. But yeah, they operate through secrecy, and it just sucks that we don't know exactly how this money is being used. So like I said, there is a Georgia campaign to repeal the funds the state currently allots to anti-abortion centers. So that's our North Star, like long-term goal, that these funds are no longer going to anti-abortion centers. Right now, what we're doing is we're committed to addressing particularly like the false advertising from anti-abortion centers. So we want to make it so that basically CPCs, AACs can't lie to folks, that they have to be held accountable to any like false advertising that they have around the services they purport to offer. So we're in like the kind of early stages of like that campaign and getting like legislation drafted to make that so that AACs can't lie to folks, or that they have to be truthful about the services they provide. So this is a campaign. It's housed under Amplified Georgia, but it's led by ARC, New Georgia Project, SPARK, and then Urge Georgia as well. We hope to not only defund anti-abortion centers, but reallocate those funds to evidence-based services and organizations. So it's recognizing that despite how horrible and awful and like liars they are, to a certain extent, they offer a service, whether it is like a free pregnancy test or a free ultrasound that otherwise maybe some folks will not have, like just won't have access to. So we feel like it's best to reallocate those funds to actual entities who can provide those services, while not lying to folks without any like hidden agenda or anything like that, or just straight up give cash to people. Just recognizing that, pregnant folks probably know what they need more than we can like even dream of stating. So let's just give cash to those people so they can use those funds for what they actually need. Questions? And I'm actually going to stop sharing my screen now.
Thank you so much. Thank you, Agbo. A lot of this information makes us really mad, but it feels good, I can say, to know that folks are strategizing about what we can do to try and cut off the kind of supports that they are draining from our public funding, so that they can't keep beefing up their ability to get in people's way. Someone asked, what does AAC stand for? It's anti-abortion centers. They shapeshift so much and use so many names for themselves. We decided we need to start calling them what they fundamentally are, no matter if if we call them anti-abortion, they're like, no, we're not. It's great. Okay. But they're going to keep calling themselves different names every time that we use their names to try and highlight what they really are. So I see a question that I want to lift up. Speaking of following the money, what percentage of these AACs would you say are funded by religious institutions or faith-based organizations? As a faith leader, I'm interested in how church and state are working together to criminalize and erase abortion and abortion access, and how progressive faith organizations can support the Amplify Georgia Collaborative to beat them at their own game. I love that question and I love that thought. All I know is it's the vast majority. What do you know, Agbo?
Oh no, like I was literally about to say the same thing. I don't know like the percentage, but yes, the vast majority are faith-based, backed. These aren't like local organizations or local clinics. These are these are national organizations that house all of these anti-abortion centers that generally are faith-based and faith-backed. But yeah, as far as like exact figures, as far as percentage or like what churches exactly are connected, I would have to look that up for you and get back to you.
And we can definitely do that. At the end of the summit, you will receive a folder of materials that you can use for any purpose. And this is something that I believe we could find one of the many published articles with data on anti-abortion centers and try and get you an answer on that. Some of them do openly associate with a church or say that they're religious, and others do not. But I think we can get some information. Another question, are there places, I realize we are running out of time, so I'm gonna take this as the last question. Are there places where folks have organized direct action to provide legit info outside these AACs? I am so glad you asked, Agbo.
Sorry, can you repeat the question one more time? I was typing up a response.
Are there places where folks have organized direct action to provide legitimate info outside of these centers?
Oh my goodness, I am so glad you asked. So yes, we actually are planning an action to basically put up posters and we paste around Atlanta, around anti-abortion centers, stating what FIT clinics are, just raising awareness about them. I am going to put the sign up link in the chat. And yes, please connect with me. I put my email in the chat as well if you want to learn more about the campaign, and also just, thank you, Rula. And also just check us out on the Amplify website. You can find more information about the campaign, how to get connected with us, and then just some of the things that we have going on.
Thank you so much. I'm gonna come back on screen and just give us a little bit of instruction about what we're doing next. This was a great session. I so appreciate our speakers. Thank you to Naomi and the Feminist Women's Health Center, to Ukwuoma and Access Reproductive Care Southeast, and to SPARK Reproductive Justice Now, and Agbo. We can continue the conversation. We also know that the Crowdcast platform, although you can get very active in chat, does not allow for a lot of conversation back and forth among ourselves and to find each other and learn what connects us. So we're breaking for lunch until 1 p.m. However, for those of you who are chatty, are feeling extroverted, or you came here looking for people to connect with in your own area or your own profession, or maybe someone with identities that you share. All of that is available by Zoom. We have provided a lunchtime Zoom. So if you drop down your schedule in the upper left corner, you'll see a session that says lunch, and it has a description, but you're not gonna go in there except to get the Zoom link. So we'll also post the Zoom link in the chat right now. While Crowdcast is paused for lunch until 1 p.m., I will open the space on Zoom. I am not going to be a presenter or facilitator. We can chat in less structured ways and make connections with each other. It's fully optional. You can find others who share your interest, and we'll be in the big room. But if there's interests to create breakout rooms based on those shared interests, then we will create them by popular request. So you're going to get that link. Let me get it for you to make things a little easier.
You can find the link at the bottom of your screen, y'all. There's a little green button that says join us in Zoom for our lunch chat. So you can find it there. And you can also copy it from the description and the schedule if you'd like.
Thank you so much, Olivia. So the green button right below my chin is join us in Zoom for our lunch chat. Optional, but I will open up that room and see you there. And otherwise, we'll see you at 1 p.m. Enjoy your lunch.